welcome to all the viewers on behalf of Endocrine Society of India. It is an initiative by Endocrine Society of India to spread awareness among all the viewers about the prediabetes and fitness. So, we have with us today four national experts from across the country who have come together to discuss a very important topic, that is fitness and its importance in prediabetes. So I'm very much privileged and I thank the Endocrine Society of India to making a part of this important discussion of today. And for this, I want to welcome our renowned, very known stalwart of endocrinologist, Dr. Sanjay, Professor Sanjay Bhadada, sir. Sir is presently the head of Department of Endocrinology of Postgraduate Institute, Chandigarh. He is also the president-elect of Endocrine Society of India. Welcome, sir. So I
Thank
also
you.
want to welcome Dr. Joe George. He's the senior consultant from Calicut and he's the director of EndoDiet Group of Institute. Welcome, sir. We also have Dr. Arundhati Das Gupta. She is the senior consultant endocrinologist from Siliguri and the director of Rudrak Super Speciality Care from Siliguri. We have with us Dr. Varun Sharma. Sir, he is the president of the Indian Society of Sports and Exercise Medicine, BHU, Varanasi. I welcome all of you, all the panelists. So now I request Professor Sanjay Kumar Bhadada, sir, to speak a few words about ESI's public awareness program and attributing this month of August for spreading awareness about diabetes as a theme.
Thank you, Dr. Abhay, and thank you, ESI, for this opportunity. So, we all know that 14th August is celebrated as Pre-Diabetes Day, and we know that most of the patients who are having pre-diabetes, they will convert into diabetes. And according to the statistics, they said that the pre-diabetes, because of impaired fasting glucose or impaired glucose tolerance, the people within 5 years, say around 30% of people from IGT, they convert or they develop the diabetes. Similarly, similar percentage of people from impaired fasting glucose also they'll develop the diabetes. So it is the right time the patient is in pre-diabetes state to prevent them to convert to the type 2 diabetes. And for that's why the Endocrine Society of India has taken this initiative to catch hold of this low hanging fruit like that people who are having the pre-diabetes. And this program is going for 3 months and to increase awareness about the general public uh, about the pre-diabetes and their harmful effect in the future.
Thank you, sir. So I just wanted to ask Professor Jay Badada, sir. Sir, can we define fitness? And is
Yeah.
this definition depend on the age of the patient? Is there any definition to fitness?
Yeah. So, Dr. Abhay, really a difficult question to answer actually. Can we define the fitness? So, I remember our MBBS days when somebody asked what is health. So, we used to define classically in our community medicine textbook a person who is having physical, mental, social, and emotional free from any problem, then that we define as a health. On the same analogy, I can say the fitness is when a person is physically, mentally, socially, and emotionally fit, then we can call a person is fit. So probably we are talking today here more about the physical fitness. So physical fitness again you can define the similar way. And as you ask, the next question is that it depends on the age. So we endocrinologists are very what do you call the uh, love the word like tailor-made. Like we say in patient management of type 2 diabetes is the tailor-made. Similarly, here the fitness is also tailor-made. It cannot be fixed criteria for all everyone. Like for a young person, the fitness criteria is different. For a sports person, different criteria of fitness. For elderly people, different criteria or different criteria of fitness. So it depends on the individual to individual, maybe at age, maybe at gender, So various things are there, and that's why the fitness is a term where you are, you can say, a good strength. I can say in the simple word for the general public, if you are having a good strength and you are able to perform your activity of daily life without any problem, then we can say person is fit for that. Thank you.
Truly said, sir. Fitness means if you have enough strength and if you are living a strengthful life, of active life, then it is physical fitness. So my question to Dr. Varun is that is there a difference between physical activity and exercise?
Thank you, madam. Can you hear me, ma'am?
Yes, sir.
Okay. Thank you, madam. And thank you for giving this opportunity to sir and madam. Actually, physical activity is any kind of, any kind of the activity where energy consumption is there above your resting level. It has to be done by your skeletal muscle. So we all know this one. So physical activity can be non-exercise physical activity. Non-exercise money, it may be leisure time, leisure time, physical activity, or any kind of the activity where you do, you do your routine work. That may be, that is included in physical activity. But the exercise, but when it comes to exercise, then everything has to be very clear. Exercise is that part of the physical activity with only one goal: maintenance and promotion of physical fitness. That's all. So exercise has to be designed, it has to be repetitive, it has to be constructed in a special way with the aim to promote or maintenance of physical fitness. Like physical fitness can be health related. For example, if I'm going little bit technical, like for example, health related, maybe cardiorespiratory endurance, body composition, where we want to optimize the body composition. Muscle fitness, it may be related with muscle strength, endurance, or flexibility. Or it may be, like sir has already mentioned, it may be different for sports person, like it may be agility, coordination, balance, power, reaction time, and speed. So depending upon which type of fitness you are focusing, then exercise has to be designed. So that is the main difference between physical fitness and exercise. Thank you.
So my next question to Dr. Joey George is why physical fitness and exercises are important in prediabetes.
Yeah, definitely. We all know that physical fitness and exercise is important for diabetes and also for pre-diabetes. Let it be diabetes or pre-diabetes, it's actually important and beneficial for everyone, everybody. So how does it improve yourself? Definitely, we all know we do exercise to control our weight. It reduces weight gain. It reduces weight also. It helps you maintain the lost weight. And also, it has definitely other benefits. Like in pre-diabetes, the person is able to improve his insulin sensitivity by doing the exercise so that his diabetes comes under control and he can move from the pre-diabetic stage to a normal glycemic state, that is not a diabetic stage. So also from the cholesterol perspective, there is a increase in HDL, which is the good cholesterol, and also decrease in triglyceride, which is the bad cholesterol. Uh, Exercise also helps you reduce the blood pressure. The blood pressure tends to come down by around 5 to 7 millimeters of mercury, and also it improves the cardiac fitness. And it is said that regular exercise reduces the coronary and stroke mortality, and also improves the microvasculature of the heart, and the person is able to tolerate more of exercise. And in elderly people, doing regular exercise reduces the incidence of fall and also improves the peri-joint, the muscles around the joint. It improves the strength of muscles around the joint, and it would reduce the risk of arthritis. And more important than all the physical things, the mental aspects of exercise, that is, it improves the mood. See, we always talk about the chemical locha, which is said by in the Munnabai MBBS. So there are so many neurochemicals that are there in the brain. So it is said that exercise tend to improve these neurochemicals in a positive way, that you feel more happier, the depression comes down, the anxiety comes down, you feel more in tune with your body, your mind and body seems together, and you have a better body image, and it improves your body and boosts your energy, endurance level, and muscle strength also. That's also there, and improves the sleep level and improves sexual life. And also, more over than that, when you do a group exercise, you do exercise as a group with your friends, family, it improves your social life, it improves your connectivity with others. So it's always so many beneficial effects for exercise.
Yes, sir. Very truly said. And actually, as quoted by Professor Sanjay Bhadada, sir, that exercise is medicine, especially for pre-diabetes patient. So, as Dr. Joy, sir, has said, so exercises in pre-diabetes, it improves weight, it improves the heart, it is good for the brain, it improves the cholesterol levels, it is good for your sleep, muscle, sexual life, as well as social life. So my next question is to Dr. Arundhati. So what are the common forms of exercises and physical activities one can start doing as a beginner?
Thank you so much, Abba, for that question. Thank you, ESI, for making me a part of this wonderful program. That's a very important question because a lot of times, a lot of us get very, energized, and then we start planning that from tomorrow I'm going to start my exercise, and I'm going to be absolutely fit. And then it so happens that you start off for a few days, and by the end of a month, you're almost done, and then you kind of leave it. So why does that happen? So first thing that we need to do is before starting on any kind of exercise regimen, we've got to decide what is our fitness level. The fitness level of every person is not going to be the same, right? So if your friend can maybe walk for 1.5 hours, it's not necessary that you can do it. So first of all, you would need to assess your fitness level in terms of your muscular fitness, your flexibility. Do not start thinking that from tomorrow you can start off with the push-ups. You can start doing 20, 25, 30 push-ups. You cannot, because you've not been doing it. So first assess yourself. How far can you reach while sitting on the floor? How far can you reach your legs? Or how much can you walk without getting tired? Initially assess yourself, and then, as has been said, that it has to be very, very individualized. As sir said, we endocrinologists love to use that word individualized, but it is so very important when you're talking about any metabolic change in the body, right? Once you've assessed your fitness level, you say that okay, like I am all right, I can go ahead and walk for about 30 minutes or so, or maybe I need to modify it a little bit. Then look at what is your goal, what is your fitness goal. Do you want it to lose weight? Do you want to just stay fit? Are you preparing for something else? So accordingly you plan a balanced routine. We basically say that 30 minutes of aerobic activity, or at least 150 minutes of aerobic activity in a week, which could be a combination of moderate and vigorous. But when you start off light. Start off with 10 minutes, 20 minutes, and then relax, right? And then gradually you can up titrate the minutes per day, and you can go up to 300 minutes per week if you can do it. But initially start off slow. What kind of exercise are you going to do? We could start off with simple exercises like brisk walking, like running, swimming, and then gradually you could take a consultation from anybody before you decide to go for something like a cardio or something. But do not be very aggressive, and do not have over expectations from yourself. Do not get you know uh, that somebody else is able to do it, why am I not being able to do it? Also, when you are exercising, it's important that you look at some other things, like for example your equipment, your shoes, where are you exercising, the place of exercise, the time of exercise. These are very small things. If you do not wear a proper shoe when you decide to start walking, you might hurt yourself. You might have a sore feet that is going to prevent further exercise. So that is important. And once you get started, it is also important that you exercise and you give yourself enough time to warm up and cool down. That is important when you're starting off with exercise. So 5 minutes to 10 minutes of warming up, and then continue exercise, and then taper it down gradually. If you're feeling tired, if you're feeling exhausted, you must know to say stop. Do not overexert yourself. And also, if you're not feeling well, I mean, you must listen to your body. You must be a little flexible initially. Do not over expect from yourself. Then gradually, as you go about it, you will be able to increase the type of exercise that you do. It could be a monitored exercise. It could be in the gym. It could be in your house. It could be in your backyard. It could be anywhere. But monitor your progress, and accordingly go ahead as you can. Listening to your body, of course.
Yes, madam. So first assess your endurance level, then decide on what are your fitness goals, and then go ahead with maybe 30 minutes of exercise per day, 5 days a week. And always start slow, as madam has truly said, and intensify. And there should be something called warm up and then warm down. So thank you, madam. So my next question to Professor Sanjay Bhadada sir. So what is exercise prescription and its principles? So most of the time we as doctors also prescribe exercise 30 minutes a day, 5 days a week. But neither I understand, neither the patient understand. So now we also write moderate exercise, vigorous exercise. So patient also ask what is moderate exercise. So sometimes patient do come, "Madam, I do yoga for half an hour. So is that sufficient?" So there are a lot of questions, sir. So please elaborate on this.
Yeah. Thank you, Dr. Abha. It's really a very, very interesting question. And again, we are doctor, we are talking about the exercise prescription. So we are entering to the area of Dr. Varun Sharma, that exercise prescription. But anyway, nevertheless, it is important to talk. So when we talk about the exercise prescription, like in diabetes, we mentioned 1200 kilocalories, three meals, three snacks, this, that, something like that. So exercise again will say like Dr. Arundhati already highlighted some part, but I'll just recapitulate again that what is exactly. Suppose we have a program of 1 hour exercise, suppose, and I think it is recommended, and I'm in strong favor because the Western textbook writes that because we are following them, is 30 minutes exercise every day, 5 days a week. But I think the Indians having more insulin resistance, we have to have at least 1 hour workout rather than the 30 minutes. We need to change this concept also. And so we can divide like first 5 minute warm up, and warm up should be started from either from upper part of the body or from the lower part of the body. Upper part of the body means you start your neck exercise, moving here and there, front joint, your neck exercise, head exercise, all these things. And similarly, if you want to start from the lower and start with your ankle, your knee. Basically, the purpose of warm up exercise is to improve your proprioception, so that before starting the exercise, your joint knows that what you are going to do, or what we can say that we just acclimatize them, our joints or the muscles, that we are going to do the exercise. So that is a 5 minute warm up exercise. Then we can come out to the aerobic exercise. So aerobic exercise main purpose is that is relatively speeder exercise, and the purpose of that exercise is to build the strength of our heart muscle. Basically, that is the purpose, that is called aerobic exercise. And that may be around 10 to 15 or 20 minutes, and that will actually convert into, if you do 5 days a week, that will convert to 150, 1.5 hour, or maybe 150 minutes per week, something like that. That will convert to 20 minutes. And that is a formula that is called, for I think may not be fair for the layman to talk about it, to achieve the target heart rate. But we have very two clinical important parameters, that you have achieved your target heart rate or not. That is one thing. If you start sweating, meaning by that you have achieved your target heart rate. Or the second thing is that if you are unable to speak one sentence without a difficulty in breathing, then you are already achieved your target heart rate. There is a clinical parameters for our audience. Then you do the strengthening exercise, that is your classic in the gym. So you build up your muscles, some dumbbells, some rods, bars, something like that. Sorry, I don't have that kind of muscles, but we can definitely try that muscle strengthening for the 15 or 20 minutes. Then next come is the flexibility. So flexibility is basically stretching. And what I say in our setting, that I think Surya Namaskar is one of the best way of stretching. And there's a lot of advantage with related to, not related to diabetes, but is per se metabolic syndrome and the mental strength. So you can do the 12 Surya Namaskar, that various names are there that can be used for the flexibility or the stretching. And finally 5 minutes for the cool down. So that is almost a 1 hour exercise program. And how to go from warm up, the aerobic exercise for your the heart muscles, then your strengthening of the skeletal muscles, then the flexibility for your to relax whatever energy you burnt, and then cool down. And I think you have another question, part of the principle of this one. So principle is very similar, that Baumert principle is for improved proprioception, aerobic exercise for the heart muscles, the strength for the skeletal muscles, and the flexibility for the oral skeleton, and then cool down. So it will not only strengthen your uh, heart and these skeletal muscles, but it will make strong your bones also. Remember, the bones are very much dependent on the muscle stretching also. So that will be actually a good combination to improve that. And I totally agree with Dr. George that exercise is very good for the mental health. Actually, it's very good for the mental health because it increase our serotonin level in the blood. And our psychiatric colleagues, actually, they started writing, you have a 1 hour walk, 1 hour exercise, and all these things. And another important principle is make friends during exercise. Make it a pleasure activity so that you can stick to the exercise. Otherwise, you do a long exercise, you will never able to do the 1 hour complete, and you will not left in between. So that is a few important what you call principles and the prescription of the exercise.
Thank
Thank
you,
you.
sir. So, like because as we are Indians, we are more insulin resistant. So, rather than 30 minutes, it is better to do exercise for 1 hour. So, start with 5 minutes of warm up, followed by aerobic exercise, then muscle strengthening exercise, then flexibility exercises, and then warm down or cool down exercises. Thank you, sir. So, my next question to Dr. Varun. So, what are the recommendation for exercises for overall fitness, especially in pre-diabetes?
Thank you, madam. Professor Sanjay sir has beautifully highlighted all actually the prescription. So there is nothing much to say. And also Dr. Joy sir has beautifully described all the physical as well as mental benefit of exercise. And madam, Das Gupta madam has already, I mean, what are the recommendations? He has already talked beautifully. But I will be adding a little bit on the structured basis actually, because many of the people nowadays are gym goers, and they are more into what are the written form of exercise prescription, what are the parameter, like for example, everybody knows that wristwatch heart rate monitor is there. So based upon that, some technical point I just want to add, that's all. There is nothing new. So like sir has beautifully said regarding exercise prescription, if the exercise prescription goes in form of a written written prescription from a doctor to the health or healthcare professional to the layman, it will be more effective. That is what I feel. So it can be prescribed in the form like frequency, how many times exercise can be given per day or per week, or intensity, how much intensity do the exercise has to be done, or it may be the duration. Can you hear me? Huh? Okay.
We lost
So,
Varun.
so yeah, uh, no problem, sir. Language. Okay, fine. So it may be the duration of the exercise, how much duration exercise has to be done, type of the exercise, like sir has beautifully said about aerobic exercise, resistance exercise, flexibility. Then you can add upon balance exercise, which is more important for elderly people or osteoporotic people, or it may be impact loading exercise, which is important for the bone health, and also the volume of the exercise, how much is the physiological load of that particular exercise, or the progression, how we have to progress. Because exercise, in order to have a positive physiological adaptation, exercise has to be progression, slowly progression. And madam Dasgupta madam has beautifully said about start low and go slow, the concept of the exercise prescription. So regarding for the just adding to the pre-diabetic or diabetic who are generally having centralized obesity, like Professor sir has already spoken, like we Indians. So aerobic exercise can be prescribed, as far as frequency is concerned, FIT principle, FITT, frequency, intensity, type, and duration of exercise. FIT exercise prescription format. So F stands for the frequency. Frequencies you can give at least 3 days per week, up to 7 days. It should be good. At least 3 to 5 has to be done. And we have to a little bit progress up to all the week of the day. And how about intensity, like sir has already spoken, it has to be moderate. If a particular person is sedentary, then you have to start into giving mild to moderate, and intensity can be measured in the form of box scale, like for example 11 or 12 rating to perceived exertion, or you can simply use the heart rate, like for example it can be more than 64% or less than 76% of your heart rate maximum. You can easily calculate by 210 minus or something, or 208 minus 0.7 into as in year. There are different formulas are there which everybody, the fitness community, knows. Then regarding the duration of the exercise, like madam has already spoken, it has to be minimum, has to be 150. There is no other way, and it has to go up to 300 of mild to moderate aerobic exercise. But more targeting into the higher intensity, then it can be 75 minutes or up to 150 minutes of vigorous intensity if you are aiming for a vigorous intensity. Vigorous intensity, like talk test, sir has already spoken. A simple way to measure your intensity is if you are able to speak one sentence, but if you are not able to sing, then that is the moderate intensity. But if you are not able to say a single sentence, then it becomes the vigorous intensity. So vigorous intensity, you focus up to 75 minutes per week, we have already know, and it may be walking, cycling, swimming, or any other way. Resistance exercise, like sir has already spoken, it has to be at least two days per week. And that 2 days has to be, if you are aiming, the major muscle of the body, there are at least 8 to 10 exercises describing the major muscle group of the body you have to aim. And if you are if you have to do the same muscle group exercise, then at least 2 days gap should be given. So we target for at least 2 to 3 days per week of resistance exercise. And resistance intensity, same intensity, moderate to high intensity, like if you are doing dumbbell or like gym exercise, like sir has spoken, then you can go the repetition depending upon your repetition maximum, how much weight you are able to lift in one go. That's all. That is repetition x, only one time. Then depending upon your maximum, you can calculate your moderate intensity or something like that. And resistance exercise can be calisthenic. Even you don't have to go to the gym. You can do your by using your own body weight, because we are living in a what you call the gravity situation. So that's why your own body can act as a resistant exercise tool, or it can be free weight, or it can be machine based. Flexibility, sir has already spoken. It has to be at least 2 to 3 days per week. And one important point for flexibility is you have to stretch. There are different types of flexibility. Like, for example, if you are aiming for static stretching, if you are doing stretch, then it should be up to the point of mild discomfort, never to the point of pain. So it has to be up to the mild discomfort. You can hold the stretch for up to 10 to 30 seconds or so, or repetition you can do up to 4 times or 3 times a day or so. And if you are talking about the little bit elderly, then you have to act balance and proprioception exercise. Risk of falling is very, very high for elderly. So that's why balance exercise has to be done at least 3 to 4 times per week. You have to target, and it has to be slowly progressive. So in this way, in a structured way, exercise we can prescribe for pre-diabetic as well as for diabetic. Same principle will follow, but certain modification is required. But the point is, movement has to be started. Exercise is medicine, everybody knows that, but movement is also medicine. So our aim should be starting the movement, then go into structured exercise. Thank you, ma'am.
So movement has to start and it has to progress. So it cannot be the same. So one question from me, sir. So you talked about smartwatch. So a patient comes and tell me, madam, I run and then my heart rate is 130. I'm 45 years old. So because nowadays everybody is wearing smartwatch while running. So now how do I know that it is 60% of maximum or what percent of maximum? So can you highlight something on that? So how do we understand what is the maximum heart rate of a particular individual, and then meaning to say which is a dangerous heart rate?
So, I think the best idea, Dr. Varun, you want to say?
I think sir's network is a bit difficult. I think he's lost his connection, I guess. So yeah, you can answer, sir. So please, sir.
Yeah. So basically, there is a standard formula in our MBBS days: 220 minus age. So that is a standard formula. Out of that, if you can achieve the 80% of 220 minus age, you can say that you achieve the optimum heart rate for that period of exercise. So that is there. But I think in these layman people, there's two very important things. One is sweating, another is unable to speak a complete sentence without difficulty. Then it is already you achieve that kind of the heart rate. So Joy and Dr. Arun, if something you want to add, please add on this also.
So my next question to Dr. George is: do we need to take any precautions before and during and after exercise?
Yeah, definitely. We need to, especially elderly people, or people with some illness, has to be doing some precautions. But first and foremost thing which is true with everyone, let it be a child to an adult or whoever it is what happens in the usual starting of exercise regime is that one fine day he has a sudden feeling that, okay, tomorrow onwards I'll start an exercise. They fix a target and they want to reach the target very fast. So one thing every person should remember is that a person who is not exercising would have an untoned body or unfit body. So when you put a target which is quite high and try to reach that, and you push too much for that, what happens is that you may sustain joint injury, muscle injury, or your body would start paining. And sometimes even I have heard my parents and my teachers say that when you get pain, it is a sign that you have exercised well. You don't have to have too much pain while exercising. So that itself means that you have exerted too much. So don't push too much when you start an exercise. Start slowly, build up your target gradually, and finally uh, reach your target and maintain it. The most important part that people forget is maintaining it. People start exercising, after few weeks the enthusiasm gradually comes down and finally they stop doing it. So as Bhadada sir as rightly said, you have to club the exercise with something interesting or something, so that you are motivated to do it on a regular basis. So that's very important. So precaution wise, you have to start slowly, gradually build up. And then people with illness like a diabetic with complication, a person who is hypertensive, having a coronary artery disease, should consult his doctor, the treating doctor, and get a fitness from him, because he would know that his doctor would know exactly how much he can exercise or how much his body can tolerate initially. So even a person having heart disease or diabetic doesn't mean that he cannot exercise. Only thing is that you might have to start more slow and build up more gradually. That's all. See, everybody can exercise. Even a person who has undergone a bypass, or a person who has undergone an angioplasty, even a person with a kidney disease, has severe diabetes with complications, everybody can exercise, but with due precautions. That's all. So your doctor would be able to guide you correctly on what precautions you need to take and how you should move forward in your exercise regime from the cardiac and diabetic perspective. And also the orthopedic part also, a person who is having joint issues, back pain, so he also should be careful. His heart may be fine, but his joint may not tolerate the amount of exercise that he's putting into the joint. And also some people who are having a knee joint problem, his doctor may restrict certain types of exercise. Some people having back problems, some of the exercise things or some muscles, you may have to be a bit kind on your that back muscles or gradually be and that's also important. So you have to consult your doctor if you have some ailments, and be sure that you're you have the correct speed of exercise and you are building it up gradually. And another two things which are very important, I don't know whether I should say it as a precaution. One is hydrate yourself well when you're exercising. See, especially in our climate, we should hydrate well, because dehydration can be very dangerous when you're exercising yourself. And the next thing is breathing properly. We should breathe properly, because often when we do an exercise, especially when you are not in front of a trainer, you forget to breathe. Sometimes you just take the weight and you hold your breath. Indirectly, what you're doing is you are increasing the thoracic cage pressure, so that the blood supply that returns to the heart and lungs comes down. That can be deleterious also. And in case of diabetic, it is often mentioned, especially a person who is on a hypoglycemic drug therapy, a person who is on a treatment that can reduce his blood sugar below normal, it's often said that he shouldn't be exercising in an empty stomach in the morning. He should have some snacks before the exercise. And also, if he is exercising, he should, at least in the initial few days, he should monitor his sugars quite frequently to see whether that exercise is leading to a lowering of blood sugar, which needs additional intervention. So sometimes a person who, like a type 1 diabetic who wants to play football, after 15 or half an hour of playing football, he might need to have an additional snack or some drink which is energy rich. So that's also important. Then Bhadada sir already said about the regime of warming up, stretching, and then doing the cooling down exercise. All those things are important. And finally, one precaution is that you should always listen to your body. If you're really feeling sick, if you really feel too much fatigue or unwell, please don't exercise that day. You can just leave it, because sometimes your body may be warning you. Also, when you're exercising, you feel unwell, stop exercise then and there, consult a doctor, because it might be something ominous also. So if you see, don't take anything of that sort of, okay, it's a mild pain or some gastritis or something like that. So if something of a symptom happens while you're exercising, take care of it, consult your doctor again and get a fitness and discuss with him, and then only continue with your exercise regime.
Thank you, sir. Yes, please, sir. So you're muted, sir. You're
Maybe
muted.
because okay, ma'am. Maybe because of some network issue, I could not hear your question. And Dr. Joy has beautifully said everything regarding the precaution. It's very nice and very informative. Actually, the rule of the thumb which we use to prescribe exercise to the pre-diabetic and the diabetic, diabetic type 1, very careful, has to be very careful. One aerobic exercise session can increase the effect of insulin sensitivity up to 72 hours. So, immediate hypoglycemia may be up to 4 to 6 hours, or it can be, it can be delayed onset hypoglycemia problem may be seen up to 1.5 days. So one has to be very careful. Rule of thumb: 15 to 20 gram of, easily absorbable glucose carbohydrate we usually give before the exercise, or after say 30 minutes or 1 hour, depending upon the requirement. Absolutely true. So one has to, and another point is hyperglycemia also do occur during exercise, like anaerobic exercise. If you focus more on sprint exercise or high intensity resistant training, high intensity interval training. So in that case, hyperglycemia also may do occur because of the counter-regulatory hormone. Therefore, that one has to be careful for that also. And ma'am, your question was regarding what? You are saying
Regarding
something to me before?
smartwatch, sir.
Okay,
Regarding the
okay.
smartwatch.
Yeah.
Smartwatch.
Yeah. Okay. Smartwatch. Everybody knows your Apple smartwatch has come so everyone wants to objectify their exercise. It's not sufficient, like 30 minutes, how much to do, how much intensity, zone 1, zone 2, all this stuff. But rule of thumb is you have to remember some simple numbers, like 57, 64, 76, 96, 96. 57, 64, 76, 96, 96. If your heart rate is less than 57% of your maximum, then it is the very light exercise. Okay. And if your exercise, your heart rate in your watch, it's more than 57, but less than 64% of your maximum, then it is a light exercise. For moderate exercise, you have to do more than 64 to less than 76%. For vigorous exercise, it is more than 76, but less than 96. And for near maximum or exercise, it may be equal to more than 96% of your heart rate maximum. This is according to the American College of Sports Medicine classification for aerobic exercise. So very light, moderate, vigorous, and near maximum exercise you can do. And according to WHO guideline, we are always focusing on moderate exercise, light to moderate exercise. So depending upon this heart rate, you can actually do your running or cycling or any kind of aerobic exercise. And nowadays, it's MAF running or slow running, that is marathon running, has become very popular also among all the fitness enthusiasts. So they are doing exercise, targeting exercise around say 180 minus your ACE or something. So depending upon your requirement. But one thing is important: how you are going to calculate your maximum heart rate. Two formula are available. Like I have already spoken, 208 minus 0.7 into ACE in year. This is high. This is the most accurate one. 208 minus 0.7 into your ACE in year. That is your maximum heart rate. Earlier we used to use 220 minus ACE, but 220 minus ACE is not so accurate. So most practical purpose, always better to use 208 minus 0.7 into ACE in year. Thank you.
So maximum heart rate one can actually easily calculate at home, and it is 208 minus 0.7 into age in years. Absolutely, sir. And as already truly said by Dr. George, that we should always go slow and gradually build up. So I want to share a story of one of my friends. He's a cardiologist and a doctor by himself, but he was very irregular in his exercise regimen, and suddenly he will do exercise, full of vigorous exercise on one day, and maybe 1 week he will not exercise. So what happened to this friend of mine is that one day he went to do exercise, and when he returned home, he developed an hemorrhagic stroke. So he said that he was not feeling well before going to exercise, but then out of that because he went to go exercise because like he was very much feeling like he should do exercise, and then he went there, and then suddenly like this happened to him, and he had an hemiparesis. So we should always check our blood pressure, we should check our diabetes status, and we should, if we have an underlying cardiac disorder and any other disorders like respiratory or lung disease underlying, then we should always consult our doctor and get a clearance certificate. So this is very important.
Absolutely, absolutely. Especially for those starting who are having symptoms of cardiovascular system, then absolutely has to be done. Even for autonomic neuropathy, also, if one is having that, not without frank symptoms, then it has cardiac assessment is absolutely important. Absolutely important.
Yes.
But for simple person who are asymptomatic, simple, even if diabetic also, starting just mild to moderate intensity, then it's okay. It has to be started very slow, very slow.
Yes, very slow. Slow and steady win studies. Actually quoted by Professor Sanjay sir in the chat box. So my next question to Dr. Arundhati is, if bodybuilding be encouraged and the supplements like whey protein prescribed by gym trainers, are they beneficial or harmful?
I'm really happy, Dr. Abha, that you're asking me this question, because just a few days back, I got into a major tiff with my 16-year-old son, who suddenly decided that he's going to go for quote unquote bodybuilding now. And then he got his grandparents to buy him a one whole tin full of whey protein and some weights. So I reach home and I see weights lying there and whey protein, and he tells me I'm going for bodybuilding. So I said, what exactly is bodybuilding? What are you planning to do? And he said, all my friends are going for bodybuilding. We are 10 of us, and all of us have decided we'll go for bodybuilding. So I said, do you even realize what bodybuilding is actually? What you want to do is basically exercise, right? And why would you need a whey protein for that? And why do you need this muscle thing? And I said, we've seen it on Google that this is how bodybuilding is done. So thank you for this question. We need to explain, to everybody around that bodybuilding is a it's a professional kind of a thing. It has to be done under supervision. It's a condition where intense physical exercise is done in order to enlarge and intensify the power of certain muscles, right? And most of all, it is usually done on a professional basis. We cannot say we'll discourage bodybuilding, having seen the number of medals that we've achieved in Commonwealth because of the bodybuilding. But we need to understand that it is a very focused way of training. It is not something that everybody and anybody is going to do. So it has to be done under a trainer. It involves a lot of changes in the diet, in the exercise regimen. And we must also realize that, lifting weights and bodybuilding has a lot of, cons to it also. There are a lot of other risks involved also, risks to the joint, risks to the muscles, risks to the heart. So it can never be done just on that basis. You cannot just buy lifting machines and this thing and just start doing this by yourself. You cannot do that. Secondly, this point is that it is not for children. It is not before the children at least reach a certain age where their muscles and bones have reached a certain optimum range. Say not at least 18, 20, after which they could start doing some exercises. People are surely interested about bodybuilding, but only under professional guidance. Now, talking about whey protein has become something like vitamin D. It's important, it's good, but it's been taken to heights where it is much beyond what it actually offers. So whey protein is basically a protein which is there in cow's milk also. It's like when you separate the curd out of the cow's milk, what is left behind, the water soluble part of the protein, is whey protein. And that's basically what is basically done is you're concentrating that protein, and that is being sold in that particular form. It's a good protein. It helps in quick protein absorption. It is an easily absorbable form of protein, which helps in muscle health. It does, but not beyond certain levels. Uh, when do you use whey protein? So somebody's going for resistance training and he needs to give an extra power to the muscle. That's when you're doing it. Somebody is going on a low calorie diet and you don't want the muscles to get wasted, so there you could put in some whey protein. It's just another form of good, well absorbed form of protein. But of course, before going for whey protein, you have to know whether you have any contraindications for an extra protein intake. Say somebody has an underlying kidney disease, or an underlying liver disease, wherein we would not want this form of proteins to be given. So I would say yes, gym trainers, yes, if he or she is qualified enough to tell you the difference between right and wrong, which in a lot of places they are not, unfortunately. But yes, if somebody is qualified, he or she would know that which amount has to be given, what is the amount of whey protein. And it's not like something that should be there on Google. It's not something that should be advertised, because it's not for everybody. It's a good protein, but it is not for everybody. In the proper amounts, it's good. There's no harm in taking whey protein. It's just another well absorbed protein.
Yes, madam. So my next question to
Back
Dr.
to you.
Sanjay Bhadada, sir. So what to eat, when to eat during exercises? So if doing exercise in fasting is beneficial, so there is a myth among our public that when they exercise in a fasting state, they will lose weight more and more fast. So is that true, sir?
So I think again very interesting question, and we generally don't read about it. I think only the trainers like Dr. Barun, and they must be guiding their students or their players that you bring banana with you before exercise you eat. And I go for a badminton coaching center. So basically, the coach or is you please bring everyone one banana after finishing exercise. You have the banana. So now again the question is individualize. What is your plan like? If person is planning to have a weight loss program, then fasting is best. Fasting exercise is better. The reason is that because then you don't have a carb or the glucose level, so that you can utilize in exercise fat, and that will actually going to help you in the weight reduction. But if you are planning an exercise for a player, then obviously fasting is not required, may not be recommended indeed, because they are going to do the more vigorous exercise and they need the carb immediately. How much time before you can eat? So if we talk scientifically, physiologically, then gastric emptying take at least 1 to 2 hours. Then ideally you should not eat 2 hours before that. But for if you are not planning weight loss or something like that, then you can at least before exercise you can eat maybe half an hour before. You can have some carb diet that is very good. And they say that you can avoid protein just before exercise because it is going to take longer time for your gastric emptying. And after immediate after exercise, I think carb diet is required, and that is very good for not only for the muscles, for good for the brain also, because that brain is requiring when you are playing. Playing is kind of a yoga, I say. Playing is a yoga, type of concentration, type of meditation. Like for example, you are playing badminton. You are concentrating continuously on your shuttle. Where is going to come? How you are going to hit? So you are actually meditating a target that is your shuttle. And for that you need a lot of glucose for your brain also to act immediately properly. So I say half an hour before and maybe immediately after exercise. And the preferred one is the carbohydrate. Maybe protein may be avoided, but again it is a tailor-made. What is your plan? If you have weight reduction, you go fasting exercise better. If you are playing, then may not be like that. Thank you.
Thank you, sir. So my next question to Dr. Varun is how to intensify exercise regimen. So you very beautifully said that how we can actually start with slow and some repetitive flexible exercises, then how to intensify.
Mute. Dr. Varun, you are mute.
Yeah. Yeah. So the whole point of giving exercise is you are giving a physiological load, and adaptation has to be there. And if adaptation is there, then plateau will happen. So you have to progress. This is known as principle of progressive overload. There are certain point, which are basically different between physical activity, exercise. Like I have always been, exercise has to be specific. That is, in a scientific term, we call it SAID. That is specific adaptation to the imposed demand. SAID. It has to be progressive overload. Otherwise, what will happen? It will be plateau. Everything will be plateau. It has to be progressive overload. But progressive overload has to be accompanied with adequate recovery. Otherwise, what will happen? Negative physiological adaptation or maladaptation, injury and illness will definitely happen. Then exercise has to be periodized. I mean, you cannot do a same time of exercise for a longer time. You have to, it has to be multi-component, and variation has to be done. This is known as principle of periodization. And like sir has already mentioned, principle individualization. That is individual. It has to be individual. So we remember by using the term SPORTY, SPORTY. Specificity, progressive overload, reversibility. If you don't do exercise, then it will detraining will happen. All the beneficial effect will go down. So it has to be in such a way. And regarding the exercise prescription technical term, I have already spoken regarding the FITT, that is frequency, intensity, time of exercise, type of exercise, volume of exercise, then VP, volume and progression of exercise. So one has to do progressive, and for progression to do, one has to know the different grading of exercise. Like I've already spoken regarding the aerobic exercise, 57, 64, 76, 96, 96, simple. For resistant exercise also, if one is doing resistant exercise, see, rule of thumb, what we say to a particular person, aerobic exercise is good for insulin sensitivity, but resistant exercise add on the lean muscle mass, and lean muscle mass is where glucose uptake is happen. 80% of our GLUT4 receptor happens in skeletal muscle. So skeletal muscle buildup is also important. So resistant exercise, intense, like I've already mentioned, one has to know the maximum weight which one can lift in one time only. That is known as 1 RM. One repetition maximum. That is only one time. Suppose my 1 RM is 100 kg. I can only lift, maintaining all the form, only 100 kg. Then depending upon that percentage, we can classify. Like for example, 30. For that, you have to remember simple. 85. If it is less than 30% or your maximum, that is 30 kg. If your maximum 100 kg, less than. Very light exercise. Light exercise, less than 50%, but more than 30%. If it is more than 50%, but less than 70%, it becomes your moderate exercise, which is recommended by WHO. And vigorous exercise, if you are doing less than 85% or near maximum, if you are doing equal to more than 85% of your 1 RM. So depending upon that this thing, we can knowing the intensity and just following the principle of the FIT-BP, that is frequency, intensity, time. So by manipulating frequency, intensity of the exercise, like which I have just mentioned, in case of the aerobic exercise, in case of the resistant exercise, your percentage, your maximum weight, and duration, how much duration exercise. So by manipulating these 3 points, you can actually progress the exercise. Like for example, if I doing a 30 minutes of exercise, aerobic exercise, then slowly within 2 to 3 weeks, I can add on the 5 to 10 minutes for elderly population who were sedentary. Then slowly I can increase the the duration, and then after say 1 month or so, I can increase the intensity slowly. In intensity, you can increase the heart rate. You can go from moderate to little bit vigorous after after sufficient adaptation has occurred, or you can you can incorporate type of exercise also. So depending upon this FIT-VP principle, we can manipulate the things and we can progress the exercise depending upon the need of that particular person, the fitness need of that particular person, the baseline fitness of that particular person. So just by increasing the frequency, just by increasing the intensity, just by increasing the duration of the exercise, or combination of the different type of the exercise, we can progress. So this is the rule of thumb which we usually use for a normal person is 5 to 10% per week. Progression can be done 5 to 10%. Whatever you are doing, you can increase up to say 5 to 10% or less than that, depending upon the baseline per week. So slowly you have to increase. So this is the principle of progression, and it has to be done. Otherwise, adaptation, positive adaptation will not happen. Especially, I have to mention one case, especially for say osteoporotic person. No, for bone health, impact loading exercise like jumping, hopping, all these things is absolutely important. Otherwise, the bone will not do any kind of positive. Even if you are a runner, even if you are a marathon runner, then you can still have stress fracture. If you can still have all the problem related to the osteoporosis. For that, you have to add on this thing. So depending upon the particular goal and fitness level, we have to progress by applying the principle of progressive overload and individualization. Thank you.
Thank you, sir. So very well said, sir. We learned so much today. So my next question to Dr. George is, sir, like how to monitor and when to expect results. So patients are trying to lose weight. They said that, okay, 1 month I have been doing progressive exercise, but I'm not losing weight. Another person says that I'm not losing weight, but I'm losing inches. So really, it's very difficult. And please highlight and clarify like how to monitor and see the results.
Yeah. This is a very common problem that we face in our routine practice. Everybody wants immediate results. So from the clinic perspective, when I'm practicing, when I advise a lifestyle modification to my patients, I monitor them. Again, individualization is there. So from the diet perspective, I ask the person to contact the dietitian after a week so that they reinforce the diet. They see whether the person is taking the diet properly. And from the exercise and the wholesome perspective, I would like to see the person 2 to 3 weeks after my first visit. The reason, not that I am going to see any changes or any results on that. I just want to see that he's comfortable with what he's doing and he's enjoying it and he's able to tolerate it well. His body is able to tolerate it well. That I assess in the after 2 or 3 weeks. In case of a patient who is coming from far off, I often ask him to have a telephonic conversation with me or with my diabetic nurse so that we make sure that he is doing it properly, and also that reinforcement also helps him in continuing with the exercise regime. That's what I feel. And after that, I usually ask the patient to come back after 3 months and then maybe follow up. If everything is going well, I follow him up after 6 months. That's how I do in my practice. I don't know whether there is any clear-cut recommendations from international societies for that purpose. And when to expect results in weight loss, that's a difficult a lot of people, in my family members, after the first day of exercise, the next day morning, the first thing I see is that they move on and taking the weighing machine and searching for the weight loss. So immediately the next day morning, that's what I see. So you shouldn't be looking for a fast result. I would say that you shouldn't be actually looking for results as such. You should enjoy doing it and persist with it. That's more important rather than looking for a targeted results in exercise. From the weight loss perspective, as already mentioned by Arundhati madam and Bhadada sir, you should be able to do 60 minutes of moderate intensity exercise regularly to get a reasonable or meaningful weight loss. And it is said that if you do that for a continuous period of 5 to 7 months, sorry, 3 months, you would get a weight loss of around 5 to 7%. And if you persist with it, in 6 months, you would get a maximum of around 7 to 10% is the maximum weight loss you can get from exercise point of view. But again, it all depends on the calorie that you spend while you're exercising. The intensity of exercise, then the calories spent during that exercise regime matters, and how much you compensate the calories. As Bhadada sir mentioned, if you're planning to weight loss, it's better to do it fasting and then not to compensate what you have spend by exercising. Because if you compensate, there's always a feeling that I am now exercising so I can eat anything or any much as I want. Actually, those people tend to maintain their weight or even gain weight after starting exercise. One important point that we should understand is that even when you are not losing weight with your exercise, as you rightly mentioned, people often say that they feel more fitter and they are losing their abdominal inches, or they lose their abdominal circumference because they get more toned up. And also it is said that when you diet for weight loss, diet alone with weight loss, if you're losing 10 kg, 5 kg of it goes from your muscle and 5 kg goes from your fat mass and water mass. And if you're exercising in a moderate intensity exercise, then if you lose 10 kg, 8 kgs you are losing from the fat mass or unwanted the weight that you're losing, and 2 kg of muscle mass only you will be using. And in rigorous exercise, muscle building exercise, even if you don't lose weight, you are losing the fat but compensating it with the muscle tissue. So finally you will get benefit if you are exercising. Even if you exercise for 5 minutes, you will get the benefit accordingly. Only thing is that 60 minutes exercise would give you a meaningful benefit. But whatever exercise, you should not be targeting it in such a way that you are looking at some extraordinary figures after 1 week or 2 weeks. You should continue doing it, and you would feel the benefit within few weeks to few months, and you will see the weight loss within 3 months to 6 months. But finally, the most important is you should maintain the exercise regimen, continue with it and persist with it so that you can maintain the benefits that you have attained with the few months of exercise.
So thank you, sir. So my next question to Dr. Arundhati. So can pregnant mothers with either obesity or pre-diabetes do exercise, and what exercises are recommended when one is pregnant?
Yeah, that's a very good question. Actually, yes. I mean, anybody, I mean, whether pre-diabetic or not, can exercise during pregnancy, provided that there are no contraindications. I mean, if the gynecologist has not said that you need bed rest, or you need to avoid any kind of particular exertion, or there is any risk, or any such thing. If your gynecologist has given you a clearance that yes, you can go ahead and exercise, then of course exercise can be done. Even in patients with diabetes in pregnancy, with gestational diabetes in pregnancy, we've had studies telling us that contrary to the concerns about the risks of exercise, women with diabetes, gestational diabetes, have been seen to establish the safety of monitored exercise with better glycemic control, lesser need of insulin, and the effect of exercise actually lasts for more than 24 hours, up to almost 72 hours. And it has been seen that with exercise during pregnancy, there is an improvement in the growth, the vascularity, the viability of the placenta, better tolerance to labor. All these benefits have been seen. But when you're deciding on exercise, a clinical judgment needs to be exercised, when choosing which mode of exercise. So when we're talking about aerobic exercises, which is basically about using large muscle groups in a continuous rhythmic manner, which means like walking or mile jogging or swimming, that kind of exercise, that has a very good effect, particularly in pre-diabetics. It would have an effect on the insulin stimulatory action. But we also need to understand that an intense bout might result in a hyperglycemic response also. So we wouldn't ask for prolonged intensity workouts during pregnancy for sure, but light aerobic exercises can be done. In addition to that, even resistance strength exercises and flexibility exercises can also be done. In fact, there have been various bodies, like say the American Congress of Obstetricians and Gynecologists, or the Canadian body of gynecologists. All of them have actually asked for resistance training during pregnancy, provided the lady has no contraindications. And apart from the benefits in terms of metabolism, it has been seen that this kind of resistance training exercises actually have an effect on the bladder, and it has been seen that there's a reduction in incontinence or bladder weakness post pregnancy in such females. However, whatever form of exercise is done, it is important that they avoid the valsalva, where there's a breath holding, and that has to be avoided, because that can cause adverse effects. And before ending this, I must also emphasize on the role of hydrotherapy, which has been very strongly endorsed by many of the bodies. And it is safe. That means, like swimming, hydrotherapy, these are very good forms of exercises. They have the potential to improve not only the metabolic outcomes, but also the pregnancy management and such. But the duration of exercise in pregnancy, that needs to be kept in mind. So maybe it's advisable that you initially start off with 15 minutes of exercise 3 days a week, and that gradually you grade it up to 30 minutes, around say 4 times a week. And at any point in time, if there is any discomfort whatsoever, say dizziness, headache, abdominal pain, whatever, mild dyspnea, that exercise has to be terminated, and adequate measures need to be taken.
Thank you, madam. So my question to Professor Sanjay Bhadada, sir. So do you think if yoga is helpful in reducing weight? And can you tell us some rules of yoga or any exercises for reducing weight or reducing prediabetes? Over to you, sir.
So, well, I think weight reduction is need to have both combinations. One is your dietary restriction, and the second is the exercise. As Dr. Jaws mentioned that, and I experienced that also. If you do good exercise, you feel more hungry. And I know people that are telling, Dr. Saab, we are doing lot of exercise, but we are not losing weight. When we start taking their history of eating habits, then they उसा आज तो बहुत अच्छा एक्सरसाइज किया तो फिर थोड़ा खा लिया जमा करके, so then it is not going to help. So that we have to maintain a very good balance between the exercise and diet, then only then it is going to help. Other thing is that percentage of exercise, weight reduction is a 5 to 10% weight reduction will going to help in various metabolic parameters, whether it is insulin resistance, whether it is the glucose control, whether it is the kidney function, whether it is the muscle strength, all these things. So that approximately 10% of weight loss will going to give you a various metabolic benefit. Of course, that will improve your appearance also. Cosmetically, it is also very important, and people are much more worried about their cosmetic appearance. So that is a boon. Tell them if you lose 10% weight, you look 10 years younger than what you are actually. So you must be knowing the same Moses formula is there in the patient of diabetes. The duration of diabetes to be added to the age of the person. So you can say various rule of 10 you can apply in the exercise also. 10% increase slowly, 10% weight loss, and the 10% or 15% of fat in your diet and something like this. So 10% formula can be there. Yeah, thank you.
Thank you, sir. So, my next question to Dr. Varun. So, what exercises are recommended for children? Nowadays, we get like a 10-year-old, 11-year-old, 60 kg, 50 kg, and then we don't have any drug for them. So, exercise and lifestyle are the only modalities to treat such patients. And then they said that we want to go to gym. So, like some say, we want to go to gym, or what form of exercise do you recommend? So, please put a light on this topic, sir. So you're muted, sir.
Yeah. Okay. Sorry about that. Yeah. So adolescents and children, let me same principle I will follow. That is FIT VP principle. If my sound is not audible, then please let me know. So frequency for aerobic resistance and bone training, I will prescribe it little bit in a tactical way, in a orderly fashion, like in a written form, like we can give to a particular subject. Frequency aerobic has to be done daily for children and adolescents. No other way. Activity has to be focused. Resistance training is also fine, and you can do resistance training up to not high-fi resistance training. I will there a certain prescribed format, but the point is it can be done at least three days per week. Bone strengthening exercise absolutely important, is a golden period. Adolescence is a golden period, like you must be knowing, otherwise it will be very difficult for to manage the decline in the bone density at the later age. So adolescence, where the physiological peak stiff bone formation is there, before the teen, or early 20s, then a bone strengthening exercise is absolutely important. And that is different from resistance exercise. That is known as empowering exercise, like jumping or hopping, all these activities, skipping, all this activity is important. Like for aerobic exercise, the intensity is similarly, same thing, moderate intensity exercise. It can be done by talk test. Like sir has already spoken, like it should be mild sweating, it should be increase in breathing, or the person should be able to speak one sentence or so. Resistance training, same thing. Mild to moderate is always recommended. Always start with mild to moderate and go into the moderate. Recommendation is for moderate. And for then you can do repetition. You can do say 8 to 15 repetition. In case of the resistance training, it can be done. And the time though, it has to be more than 1 hour for children. You have to give time for them to play. For children and adolescents, aerobic exercise has to be equal to or more than at least 1 hour. At least 1 hour. Resistance training, same thing, at least 1 hour per day. You have to focus. Bone strengthening, same point. And the type of exercise can be done anything which is enjoyable. You just make him or her play. That's all. And structured exercise, structured can be built on upon that. That's why it can be running, it can be brisk walking, it may be swimming, it may be dancing, bicycling. Exercise can be divided into two types, mainly weight bearing and non-weight bearing. Non-weight bearing exercise like bicycling, swimming, aquatic exercise, they are non-weight bearing exercise. And weight bearing exercise like, for example, jumping, running, and any kind of the sports activity, these are important. And strengthening exercise is also important. You have to focus on major muscle group of the body. And for the bone strengthening exercise also, jumping in a class, school based activity has to be incorporated, because you cannot miss that golden opportunity, so that you build as much as bone density as possible in that particular time, because that is a physiological time. After that, after you say 30 years, then it will gradually fall. So the purpose of exercise at a time is the limit the decline. So adolescent is the golden opportunity to add on bone strengthening exercise. It can be anything. It may be, jump rope, or it can be tennis, or any kind of racket sports. It can be divided depending upon, say, how much your technically ground reaction force, we call it ground reaction force by mechanical term, where, like, for example, jumping can be, you can, the load on your muscles and joint can be up to 3 times of your body weight. Like, for example, some of the gymnastic, they go up to 10 times your body weight. So depending upon the loading, the bone strengthening exercise can be prescribed. Like, it can be 2 times of your body weight, like simple jumping or vertical jump. Counter movement jumping is also known as, you can go up to 3 times your body weight, or you can go any kind of the racket sports. So bone strengthening exercise is very important, apart from the resistance exercise and aerobic exercise. Acha, one point which I want to just add, this is regarding, this is what general rule of thumb. This is rule. Everything has to be individualized. Like, for example, when to start weight training, because there is a fear among the population that weight training might damage the growth plate. Otherwise, stunted growth will happen. All that problem will happen. The rule of thumb is, it has to be, everything has to be technique based, not load. High loading should not be done. It should be, you should spend more time, to your children, so that they learn the technique. Technique is more important. And only, say, after, say, 16 years or more than that, then you can incorporate the adult based, the training, resistance training, after they have learned all the technique based thing. Just like marathon also, like, for example, long distance running also, we generally prescribe, the half marathon, that is 21.1 kilometer, that around, say, 15 to 16 years. After 18 years, you can allow them for marathon and all this, depending upon the individualized, requirement. So weight training can be done, but the thing is, it has to be mostly technique based, low weight and slowly increasing. Similarly, long distance running, aerobic exercise also important. But one thing is important is, which sports to choose. For children and adolescents, sport specific training is not given. It has to be generalized. Otherwise, particular injury, problem will happen. So we generally limit the specialization of the sports. It has to be generalized, aiming on general fitness. So this is the principle for children and adolescents, which we follow. Thank you, ma'am.
Thank you. So, we can take 2 more class questions, like, if we are comfortable.
No problem. I am comfortable. Yeah, no problem from my side.
So my question to Dr. George is, so what exercise we prescribe to elderly and osteoporotic? So it has been already said that bone strengthening exercises like jumping, and then all these things are there, like it will improve the bone mass. But then in elderly, again, they are frail, frailty is there. So what type of exercises?
Yeah, see, the what type of exercise to be done in elderly, I feel it would depend on the physical condition of the person and its cardiac fitness, and also age is just a number nowadays, because some age, a person 70 year or 75 year, it comes usually in the WhatsApp group in our area of our film actor Mammootty, who looks much younger than myself, who is already past 75. So it's just a number. So it all depends on how fit you are and how your personality you have developed over the years. And if you are capable of doing the exercise, you should be doing it, and you should do the normal regular exercise, provided you are cardiac fit and you're physically fit. But if your body and the heart, the systems are not doing perfectly fine, you have got a cardiac evaluation done, and there is some risk involved, then you should limit yourself. And in the frail individual, in the elderly frail individual, where the priorities changed based on your physical condition, and in frail individual, the concentration would be to not to fall down and not to damage your body and to have an osteoporotic fracture. In those individuals, as already mentioned, you should be thinking of more of a aerobic exercise and stretching exercises, so that the muscle strength is maintained without any loss in muscle mass, so that you maintain that and you reduce the fall incidence. So it all depends on the condition, the health condition of the person.
Thank you, sir. So, my question to all the panelists, last question. So, can there be a reversal of prediabetes with exercise?
Of course, yes.
Yes.
Of course.
Absolutely.
Absolutely. So,
I
so
need some
definitely,
few last liners. After that, I'll say.
yes, sir. So, definitely, pre-diabetes is treatable, or like exercise is a medicine for pre-diabetes, and we have to start slow, and but we have to be progressive. And if there is any underlying conditions, then definitely we have like cardiovascular disease, respiratory disorders. In those conditions, like pre-examination by a doctor and clearance has to be taken. Children should exercise because for children it is very important to attain a peak bone mass and peak muscle mass, as Dr. Sanjay Bhadada sir has already mentioned in the chat box. Very true, sir. And also, pregnant women can exercise if there is no contraindication, and exercise should be tailored according to individual goals and individual need and individual endurance level. So, over to Professor Sanjay Bhadada, sir, for closing remarks.
Yeah, thank you very much, and I think I have learned a lot. And as I mentioned in the chat box also, there now I am convinced that exercise is pain medicine. It is from your brain, your muscle, your heart, for everywhere it is very useful. And the few tips for the exercise: exercise like that where you feel pleasure. That is very very important. Any boring activity you are not going to continue the exercise. It should be group exercise, not an individual. You are not going to sustain exercise if you do individual. It is a good time to spend time with your family members, even that is even very good. Seasonal exercise, very important. I am from Chandigarh, currently working. So Chandigarh is known for Barish, Kharish and Shifarish. So all weathers are very worse. So you cannot say, suppose it is a cold December, January, lot of fog is there, you cannot go out. You have to have some idea to the indoor games. Like in rainy season, lot of rain, you cannot go outside. Again, you need some indoor. Like in so you have some alternative choice for this exercise, not only the single exercise. Then, as Dr. Joy mentioned, that no unrealistic expectation. One day exercise, looking at the weighing machine, how much I lost. So that is another thing. And of course, Dr. Barun already told that it should be very gradual. And Dr. Arundhati mentioned already, every age group should be ready for the exercise. And in India, I think in the Western, this is about 2 years they can plan for the exercise. I don't know, maybe too early, but in India, that all gyms are allowing after 18 years or 16 years, not before that. So can be started exercise at that time. And during this discussion, I also learned new term like peak muscle mass. We talk peak bone mass often, but we don't think about the peak muscle mass. Maybe muscle mass changes more frequently, but it can be done. What is the peak muscle mass and what is the age for that? And reinforcement for exercise is very good. So we have every year this type of program, so that at least once in a year we can tell our audience that yes, it is important. Exercise is important. You must do exercise. So thank you, and over to Dr. Abha to take the proceedings further. Thank you very much.
Thank you, all the panelists. It was a very interesting, very interactive, and very learning session. And I think I learned so much. Our audience has learned so much, and many of our doubts as new endocrinologists have been cleared. So I thank Professor Sanjay Bhadada for your time and your like enlightening discussions. And I also thank Dr. George, Dr. Arundhati Madam, and Dr. Varun for this informative session. So thank you, everyone. And to end with, by ending the session, I just want to make an announcement that tomorrow, that is 14th of August, we are celebrating the World Prediabetes Day, and we are coming live tomorrow, like at around 7:30 a.m. So the flyers are being shared, and I request all the viewers and everybody to join us on that day and celebrate World Prediabetes Day. Thank you, everyone.